Hey guys, a lot of people have been asking me through messaging about the actual risk of children in the setting of COVID-19. The strongest data we have today comes from China, and it's from the Chinese CDC, and it was published on the journal JAMA here in the United States late February of this year. And it was based on a collection of over 44,000 confirmed cases of COVID-19. In that collection of patients, only 1%, 416 patients, were children, and the mortality rate of those 416 children was 0. This was referring to children younger than 10. That data does not specify if those 416 children in general had a fully benign course of illness, but the 0 mortality rate seems to point in that direction. 2 case series from pediatric doctors from China published on a later time showed actually that of collections of just 10, 20 children, the rates of severe cases of COVID-19 were 0. So there's a suggestion to think that children tend to have a more benign course of the illness and that their mortality rate is much lower. The information continues to change because we're talking about getting to know a virus that didn't exist before. So therefore, the data is in flux, and the numbers that I give you today might change. What we know today from the description of the pediatric doctors in China is that the virus seems to cause a syndrome in children much alike the one it does in adults, meaning fever, dry cough, and fatigue, with fevers usually surpassing 100.4 degrees Fahrenheit or 38 Celsius. However, just like adults, children are allowed to have a myriad of symptoms as part of their COVID-19 syndrome, meaning they can have a runny nose, they can have shortness of breath, they can have lack of appetite, they can have low-grade fevers, they can have nausea or vomiting, or they could have diarrhea. The important thing to remember is that despite the fact that the likelihood is not low that if your child has a febrile disease nowadays in the United States, it could be COVID-19, this does not mean that you should promptly take your child to an emergency department setting. Remember, in doing that, you are exposing others to your children most likely benign course of COVID-19, or even worse, getting yourself and your child exposed to COVID-19 if that was not the original viral infection. This is the time where children, just like adults, need to follow social isolation. And particularly important is going to be to keep grandparents away from grandchildren, since it's going to be the former group who's at the most risk for a severe infection. A lot of the harm that viruses like COVID-19 can do in an adult have to do with an overwhelming inflammatory response to the virus, meaning the virus itself is not causing direct harm, but the immune reaction of the host, it's so exaggerated and it's happening on such a frail tissue like lung tissue that can cause respiratory failure. Children might not be mounting such a strong inflammatory response, which might be the reason why they fare better. That being said, they are tremendous vectors for viruses because the virus is happily running through them. So we have no idea of how long children in general are going to be infecting others or the power with which they're actually expressing the virus. So again, isolation is key. The moment for you to become preoccupied with your child's course of a cold these days, which one could assume could be due to COVID-19, stays the same as your pediatrician has told you in case of other viral infections, meaning if your child is having any symptoms that is concerning for breathing difficulty. Remember that children breathe very rapidly, so make sure you have the numbers right with your pediatrician on how many breaths per minute to count on your child to objectively know if your child is in respiratory distress. Also, nasal flaring when breathing and retraction of the skin on top of the sternum or on the sides of the ribs or in the abdomen are also signs of respiratory distress if your child is presenting that when he or she is breathing in. So far, there have been no reported cases of congenital COVID-19, meaning the newborn getting the infection from either the birth canal or during pregnancy. And again, from the data that I just quoted, it seems to be that the overall risk of children below the age of 10 of having a severe case of the COVID-19 is low, and their death rate also is very low.